brothers and sisters, our mothers and our fathers, my friends, my associates, my colleagues. I'm happy to see you again. This is Dr. Jolo again. It's my pleasure to have you in my show. I'm sure you are looking forward to this show. And I can tell you, like as usual, it's going to be a show that you always gain something from. Well, DJM3, it has come to stay, hopefully. And I know it will be value added. We really enjoy the feedback that you've been giving us. We are really encouraged. And we look forward to more. And be rest assured that the best is yet to come. And this collaboration will move from strength to strength. Thank you. Now, ladies and gentlemen, DJM3, Dr. Jolo, Musical Medical Mission. Last episode, we spoke exhaustively about breast cancers. This week, we have another interesting topic, which I'm sure you, your friends, family members will find even more interesting. This week, we'll be talking about the cancer of the cervix. Cancer of the cervix. What is the cervix? The cervix is part of the womb. It is the entrance into the womb. It's the organ, it's the tissue between the womb and the vagina. It's a very important part of the female reproductive organ, and it is from there, it is on this cervix we'll be talking today. The cervix, incidentally, cancer of cervix is the commonest cause of death in cancers in women today. The commonest cause of death in women today, particularly in the third world, is cancer of the cervix. And I must tell you, and it will interest you to know that already they have vaccination for this. Girls that are that are in their teens, if they have the privilege, if they have the privilege to have the vaccination, it will protect them from cancer of the cervix. Please remember, there is vaccination for cancer of the cervix. So a lot of mortalities need not be because of this. So mothers, sisters, ladies, take care. Remember this. You can get your vaccination to prevent you from having cancer of the cervix. Now, what are the symptoms of cancer of the cervix? What causes it? Let's start from causes or predisposing factor. It has been highlighted that certain reasons are predisposed. It is known that certain factors are responsible for cancer of the cervix. The first one is early sexual exposure to sex. Early exposure to sex. This is the first one. And multiple sexual partners is also contributory. Infection is also contributory, particularly infection by viruses. Viral infection is, you notice that infection by certain viruses is contributory. I don't want to bother you with the type of viruses, but let it know that sexually transmittable diseases, particularly the viruses, are responsible for cancer of the cervix. Likewise, multiple sexual partners. So it's better for you, if you must engage in sex, have it with one partner who hopefully is having it with only you. Because when you are exposed to multiple sexual partners, you are exposed to the cancer of the cervix. There are then another predisposing factor is mid trimester abortion. When I say mid trimester abortion, if a woman is pregnant, the average time for the term pregnancy is 9 months. If a woman loses her pregnancy between 4 months and 4 months and between 3 months and 6 months, if a woman loses her pregnancy between 3 months and 6 months, she has higher tendency to have cancer of the cervix. These are some of the issues. These are some of the factors that contribute to cancers of the cervix. How does cancer of the cervix present? The first line that we present with is vaginal bleeding. Vaginal bleeding in this case is either in between two periods if there is bleeding, or bleeding after sexual intercourse, and bleeding postmenopausal. When I say postmenopausal, if you see an elderly woman who has stopped menstruating, come to complain to that she has started menstruating suddenly, one of the factors that must come into your mind is to consider cancer of the cervix. And apart from this bleeding, there is usually discharge from the vagina. And this discharge is so much, it will be copious. We call it copious. It's so much, and the smell, the aroma is a bit offensive, perhaps because of the secondary infection. And how do you manage it? How do you manage it? The first of line of action is to go to the hospital. You need to be sure of the diagnosis. And how is it diagnosed? The doctor, after having asked you the question and taking the appropriate notes, he will have to recommend the patient to have a pap smear. We call it pap smear. Papa Nicholas smear. This is what we do. A sample of the cervix will be taken, and this sample will be taken to the lab. It will be taken to the pathologist, and the pathologist will look at the sample. They will look at it physically, then they will look at it under the microscope. When they look at it under the microscope, they will see cancer cells if the cancer is malignant. And should it be malignant, the first line of action is to start treatment immediately. How do we treat cancers of the cervix? Apart from the conservative management that we usually give to cancers of the cervix in terms of antibiotic cover, the use of analgesics to cover to alleviate pain, you still have to give antibiotics, the use of antibiotics and analgesics to control pain. You have to subject the patient to radiotherapy. You subject the patient to radiotherapy. Radiotherapy are different types. I don't want to bother with the details of this because even when the patient has been found to have cancer of the cervix, we need to stage the cancer. There are four stages in cancers: stage one, stage two, stage three, stage four. Stage four is the advanced one. That is when the cancers are spread to other parts of the body. But in the early stage, the first line of action is radiotherapy. And there are two types of radiotherapy in the cancer of the cervix. We have the brachytherapy and we have the teletherapy. Brachytherapy is when you use radiation at close quarters. You use radioactive sources to attack the cancers, to burn out the cancers over a period of time. This is very effective when the cancer is in early stage, that is stage one stroke early stage two. And the next time of the other type of radiotherapy is teletherapy. This is when we use radiotherapy from another source, external source, to beam on the pelvis, from the outer source to beam on the pelvis of the patient to burn, so to say, burn, quote and unquote, to burn the cancer cells. So if everything is done properly, and usually this is a very technical aspect of the treatment, because for us to know what to burn, we need to know we need to know the type of cell, we need to know the grade of cell, we need to know how far the cell has gone. Then that is what we use to calculate the amount of radioactivity we will put on the tumor. Having done all this, and hopefully the practitioner knows what he is doing, the cancers will be burned off. That's why I always advise, the best time is the first time. The best time, remember, the best time is the first time. Always screen yourself. Screen yourself. When you screen yourself very well, and if it happens that you have these cancers in you, screen yourself, start the treatment immediately. And another form of treatment is in the use of hormone therapy. Although this is very advanced, the use of hormone therapy is a very advanced technology. It's not available in this part of the world yet. Then another treatment is chemotherapy. But the most effective is the use of radiotherapy to treat cancers of the cervix. Having said all this, I hope I've been able to educate you, because other points I would like to raise, and not within the confines of where we are now, but just to give you the rudimentary knowledge of cancers of the cervix. Ladies, please screen yourself. Young girls, if you have the grace, take the vaccination. It will be protective for you. And then watch your habit, your sexual habit. Be hygienic, and don't be too far from your patient, from your doctor. We are here for you. I'm here for you. If you have any questions, feel free to contact the number on your screen. Feel free. Ask us the questions. We'll get back to you. Enjoy yourself. Have a beautiful life. We are here at your service. Thank you very much. Well, having said all this, you know the protocol. You know what we always do here. After labor is refreshment. Let's go to the other room. Let's catch some fun. Let's listen to the saxophone, talking drum, to some keyboards. Relax. See us. Let us dance. Let us listen. If you can't dance, just have the pleasure of listening to good music. Life is fun. Enjoy yourself. Thank you very much. Cheers.